All right. Thanks very much, Sneha, for those details. Sneha pointing out very importantly that the cases that have been reported right now in the country weren't those with any travel history to China. So not necessarily linked. HMPV has always been around. And that's why you've got 4 cases also in the country. But I'd like to now bring in Dr. Krishan Chugh, who is a leading pediatric pulmonologist in the country. Dr. Chugh, thank you for your time. The reason we decided to have you here on India Today is because there's a lot of concern among parents right now. 4 cases that have been reported are all of infants. So I want to know from you, Dr. Chugh, first of all, are newborns, are infants more susceptible to HMPV?
Well, infants are, but probably not newborns. Generally, it is seen that the maximum incidence of this disease occurs in, let's say, 4 to 6 months age or somewhat later, not in the first few months of life. So, but yes, infants are more prone. They have not yet been exposed to this virus in the past. So first time when they are exposed, their immune system is not yet fully developed. Hence, they are more likely to have a comparatively more severe disease. And that is why our alarms are higher when it comes to seeing an infant with suspected respiratory infections. Most of the times, this respiratory infection is like any other infection of the respiratory tract. It is only seldom and very few that it becomes severe.
Okay. Dr. Chugh, my second question to you, and this is again what's doing the rounds right now where everyone's asking this, what can parents actually do to protect their infants right now, Dr. Chugh?
Well, since it is not very much around, that not that every other child or other adult is suffering from it, there's no real need to protect children in that sense like we did in COVID days. That is definitely not required. And then it being small infants, you can't be using masks and all. What can be done is that those who have respiratory infection, whether it's adults or somewhat older children, let's say 3, 4, 5 years, let's say the elder sibling of an infant, when they have infection, they should be kept a little separate for 1 to 3 days till they start improving. Otherwise, it's not really necessary to have any other precaution for the time being. Yes, if the child starts suffering from illness, then we quickly seek medical help.
So how would you define this illness, Dr. Chugh? What are the symptoms that people should watch out for in infants?
They are very much like any other, what we call as a viral infection of the respiratory tract. That means runny nose, stuffy nose, blocked nose, some degree of cough, some redness of the face and the whole body, some degree of fever. But generally, this is where the symptoms end. It is very seldom that somebody will start having a fast breathing and a pneumonia.
Okay. And my final question to you is, Doctor, can HMPV actually be fatal for infants, for toddlers?
Well, guarded, yes, it is possible that it can be fatal. But that will be very, very rare case. After all, it is less than 1% or maybe 0.1% or even less in our experience, whatever few cases that we have tested for and found positive. We are not given much, let's say, importance to this, that this is the virus and that we should be kind of doubly careful about it. No, we just take it as one more respiratory virus and treat it as if it's an ordinary viral infection. So what I would say is that if it is the only virus which is causing the respiratory illness, it is not likely to become a severe or a fatal disease. If there are more than one virus, or a superadded bacterial infection sets in, then it may be a different story.
Okay, that's incredibly reassuring, I'm sure, for all of our viewers as well. Thanks very much, Dr. Chugh, for joining us with your expertise on the HMPV symptoms to watch out for. Why really there's absolutely no reason to press the panic button right now, even if you're a parent with a newborn, with an infant. It's not something that's extremely critical or serious. And you just heard from Dr. Chugh what really are the symptoms to watch out for. Let's cut across to breaking news coming in.